Let's have a look to some manual techniques for improved functional quality of the abdomen, in particular the inner organs, the membranes and the tissue around muscle and fascia. I start with a very general technique, moving from the left to the side. I grasp the body and I move it with the intention to move the inside of the abdomen. Very gentle, go a little down to the lower belly, the middle part on the level of umbilical, and then as much as I can I pull a bit up in the upper part. I just move gently and I'm searching the rhythm, the frequency which is harmonious to the tissue. Sometimes you have to go very slow because there is tension and pain. Sometimes you can move in that rhythm as I do here. Look a bit to the respiratory frequency, to the cycle of movement from the chest, and then you can harmonize it. Second technique, I go to the iliac spine, and on the inner side of the ilium bone I go deep down until I can touch the descendant colon. There I massage, pulling it towards the center, towards the midline of the body, or with gentle circular movement, little circles. I'm starting on the lower part of the colon, coming up to the middle part and to the upper part of descendant colon. The horizontal colon I expect to find in this region. I will find it easily when I do this little palpation stroke transverse to the alignment which I'm expecting. So now I'm working with this flat hand technique, deep circles, and then moving the transverse colon downwards. While my hand is circling and moving slowly from the left to the right. Once achieved the angle here, I just go back with that deep stroke. Like this. The ascendant colon I found here. I touch the iliac spine, go deep into it, and then I move a little bit to the central line. And again I mobilize it from the lateral part to the medial part, and I'm doing these circulatory movements, little circles, beginning on the upper part and moving myself slowly to the middle and to the lower part. Please note the lower part is a little bit more medial as it on the descendant part. Another technique is more for the central part of the belly. I just grasp in it. With one thumb I push it back, and with the fingers I catch it. Slowly and gently I move through the intestine, the center part around the umbilical section. And I can increase this movement using the fists. Now I'm just shifting all the insides to the left, and then I'm pushing into the left and I'm shifting it to the right. Whenever I can hear some belly sound, it is welcome, it's fine. Let's come now to the stomach region, which is in here. I gently go below, underneath the rib cage. And I massage gently here the abdominal muscles, the fascia, and I move, going in like this, move with 2 fingers towards the stomach. I can use this pulsating movement as well. I'm directing to the stomach, just underneath of the ribs. I'm doing these vibration oscillatory movements towards the stomach. With my fingers I can feel the response of the tissue and I adapt my pulsation to this response. It shall end into a harmonious swinging phenomena of the tissue. It is indirect massaging of the stomach and the diaphragm due to this pulsating movement. Let's come to the gallbladder region, which is here. The same technique, long stroke below the ribs, massaging gently. I just go with my finger under the rib, massaging gently, moving it from one side to the other. And this pulsating movement. I'm pointing with the vector, the alignment of that movement towards the gallbladder. And I adapt my moving of my hands with the response of the tissue. Where there is hard and tense, maybe I have to move it a bit slower. Where it can swing quite easily, I can move it a bit faster. If ever I can feel what we call a barrier, it's just an involuntary muscular defense tension, I go gently. I do it just gently. The same on the liver. With 2 fingers, as I did on the stomach, I go towards the liver. I can squeeze the liver and move the liquids in the liver. I can even ask the patient to breathe towards my fingers. Please breathe in. So we are squeezing and you let go. You breathe in and we squeeze. Sometimes we have acute pain and there's a blockage of the liquid. So with this technique, sometimes you can relieve it. For the splint, I'm holding the ribs like this and then I go inside, below the small ribs. For the kidneys, almost the task is to warm them up, to give warmth to the kidney. So I'm grasped between the pelvis and the back part of the rib cage, and I can do vibrations. I'm pointing my vibration to the kidneys, which are just in front and lateral of the spine. We will find them more on the back as we think. I can do this technique with one hand and the other one is reinforcing. That's some basic techniques which we can use. To close the session, I always close with a circular stroke, which is going in the direction of the clock, because the feces, they will come up here, they go over there, and then they come down.